Meeting is being live streamed. Okay. I'm the one live streaming it. Usually when the bar moves halfway through, my gosh, we just got it cold today. This is great. Hello, everyone. I've got to now move our big faces off of my screen or else I see us twice, Kim, and that's scary. Hello, my name is Dr. Jennifer Gardella, and I am here with Kim Everett, who is the Executive Director of BCHIP for Bucks County, the Bucks County Health Improvement Partnership. And today we are talking about hospitals. Kim, how are you today?
I'm good, thanks. Thanks for connecting again today, Jennifer. Looking forward to talking about our healthcare system partners. It'll be great.
Yeah, so yesterday was National Hospital Day, and I didn't make this up. It's a bona fide day of the year and a great time to recognize all of the work that our hospitals done. Our hospitals, I have to say, in Bucks County have gone through radical transformations, right? They've been taken over, assumed, renamed, all sorts of stuff's going on. So, and they are phenomenal partners of BCHIP, aren't they?
They are. So each one of our health systems here in Bucks County were the founding members of BCHIP. So we're very committed to our health systems and our hospitals, and we really appreciate the support that even after all those changes you just talked about, and we can talk about them a little bit more, that they have remained committed to this work and seeing the value of how their collaboration to address gaps in healthcare really makes a difference for a community.
Yeah,
So,
that's it. Identify the gaps in healthcare. I love that that is part of your mission. So Doylestown Health, Grandview Health, Jefferson, Lower Bucks, St. Luke's, and St. Mary's. I don't know them. I just read the list.
I was going to say, wow, I'm really impressed. Yes. So when BCHIP started, each one of them were an independent hospital. But because we know that healthcare is always changing. In fact, I mentor public health students. I always tell them, if you don't like change, get out of healthcare, because we know that healthcare is always changing. So our hospitals have all become part of larger health systems. Laura Bucks is part of the Prime Health Network. They are the only for-profit hospital we have in Bucks County. But then we have Jefferson Bucks, which is part of the larger Jefferson Health System, which just expanded into the Lehigh Valley. So lots of big work going on there. Then we have St. Mary, who is part of the Trinity Health Network, which obviously extends well beyond our community across the country. Doylestown Health has currently signed a letter of intent to collaborate with the Penn organization, but that is still under negotiation, and so that's not officially happening yet, at least to my knowledge as of today. But I know that they intend to work well together. Grandview is an independent hospital at this time. And then we have St. Luke's up in Quakertown, which is part of the larger health system that goes north of us here in Bucks County. So they're all, for the most part, except Grandview, part of larger health systems. And yet, so they're very obliged to follow policy and procedure for those organizations, right? Which is fine, as it should be. That's the benefit of having those systems. But they've been able to still be involved at a local level, which has been very good for the organization and very good for our community.
Yeah. So what kind of work do you do with them?
So primarily the hospitals, well, as we know, the hospitals are one of the funders of BCHIP, so that's certainly much appreciated. But more importantly, what I love about the hospitals and the model for BCHIP is when we identify a best practice, the goal is to get each one of those health systems to implement that best practice. So for instance, what the B Cares program, right? We know that warm handoffs for patients with substance use disorder in the ER have an increased rate of people agreeing to seek help. And so that's great. That's what we want. And so in true BCHIP format many years ago, before me, when the county had funding to implement this and they came to BCHIP, we were able to say, yes, we have those relationships with all the hospitals. And so the hospital CEOs all agreed to implement that program immediately. Now they all have to tweak it a little bit and customize things for their own organizations. But it did allow us to roll out that best practice model very quickly across all 6 hospitals. And so that's just one example of some of the things we're doing. One of the most recent things we launched is a Building Community Partners group. And that's because we know the leaders of their case management or home care programs really just are so inundated and busy, but sometimes it's really challenging for them to know about all the resources in the community. And not just to know about the resources, but to really have connections, right? It's always better to be able to say, hey, I know so-and-so over at Family Service, or hey, I know so-and-so at Opportunity Council. Or so we're doing a 30-minute presentation every month for the director of case management or whoever their hospitals identify. It's open to anybody in case management or social work that wants to come. And they get to meet a different community partner each month. They're very quick. They're only 30 minutes. I tell our community workers, they're down and dirty, 30 minutes. They get 30 minutes, 15 minutes to present, and then 15 minutes for the health systems to ask questions and talk about challenges and successes. It's been very successful so far. So that's another way that we interact with our hospitals, is supporting their needs. And that's really where BCHIP comes from. What I find interesting is lots of times I'll get community folks that come to me and say, oh, can we get on your board of directors meeting because we want to ask the 6 hospitals for money, right? Everyone thinks our health systems have so much money. I can tell you that they don't. I know most of you that are watching probably wouldn't believe that, but we have the data to show that our health systems, particularly here in southeastern Pennsylvania, are not rolling in the dough. And I think that we as communities have to stop thinking that hospitals and school districts can solve every problem in America, right? We keep putting that ownership on our school districts and our health systems. And so what I try to do at BCHIP is, while they do give us some funding support, to me, if I do my job well, I'm going to find, as they identify gaps, I'm either going to find a community partner that's already addressing those gaps and connect them to that, or I'm going to say, well, you all have that same gap. Let's look for some funding to address it and bring those resources to your hospitals. Because they've made it abundantly clear that, BCHIP should not be coming to them asking for additional funds, which I respect.
Absolutely. And you have that initiative going on with the safety for healthcare workers,
We
right?
do.
And that's
We do. So we did launch that back in the fall, and it's kind of been tabled, if I'm honest, but only because of just lack of resources. But we just recently connected again with some of the folks that were involved in that work, and we're looking to set up some data standards that we want to try to get across the health systems here in Bucks County. So we'll be convening that group again very soon. And we do want to reach out to the DA's office again, but gosh, we had a new DA starting in January, and boy, I've lived and worked in this community my whole life, and we've had some really violent, terrible crimes. And so I just didn't feel comfortable going to our poor DA's office saying, hey, can we talk about how we can, support all the hospitals, while she was in the middle of some real challenging cases. And so out of respect, we kind of tabled that a little bit, but they're very open to working with the health systems, and we do want to look into what we can be doing to improve the safety of our healthcare workers.
Yeah, and anytime that there's a big issue, we know, like, come to BCHIP, because you've got at least you're the center of the octopus, where you can go out there and you can talk to hospitals very quickly, because you already have those relationships built, which is part of the work that you do.
It is. And what's nice is they have the relationships among each other. So
Right.
When a pandemic breaks out, God forbid, right? But when a pandemic breaks out and you have a footprint like BCHIP, we had those lines of communication already established, and they had trusting relationships. And I think that's really the key.
Sure.
I know other surrounding counties have tried to launch a BCHIP, and they have not had that success. And I think it is because of the history and the trust and the relationships that are established that it's been able to maintain the work that we do, and the identity and the value to the community.
Yeah, absolutely. And just the collaboration, so that everybody knows what the other players are doing, and there's no competition defined at least by lines, right? Yes, there's always competition, and your doctor may be in the different part of the county and you have to go to that hospital. But for the most part, I feel like you bring everyone together for the sake of the community, what's best.
Yeah, and what's nice is our BCHIP board comes to the table with the same mission.
Right.
So I think that's what's so great. Our hospitals really are committed to our communities, and they demonstrate that in many ways, but BCHIP is one of them. And so BCHIP gives them the platform to do it collectively, which is kind of nice, because I believe that allows us to have a bigger impact than each one of them trying to do their little piece. In fact, one of the things the hospitals are all working on together now is their community health needs assessments. So
Oh,
where each hospital used to have to do that individually, now they're coming together. and doing that collaboratively. So that's really nice because then we don't just get data for each hospital, we get data for the entire community. So just another example of them working together.
Yeah, it's awesome. Okay. Well, again, in honor of National Hospital Days, which was yesterday, coinciding with Mother's Day, representing all the hospitals here or I should say, shouting out to all the hospitals in Bucks County, with BCHIP kind of at the center of the communications on that. So thank you for the job and the role that you take on and making sure all that happens, because it can't be easy all the time.
It's certainly fun for sure. Day is never dull. Never a dull day.
Okay, guys. Well, until next time, Kim, thank you very much for your input, and we will see you with our next topic in a couple weeks.
Sounds great. Thank you.